Hola, I'm Dr. Mariano Rocabado, and I would like to invite you to a very special program, BOC, which is actually a combination between dentistry, occlusion, physiotherapy, musculoskeletal conditions of the craniovertebral joints, and how they relate to the synovial temporomandibular joint through a very important situation of relationship between occlusion, how it affects the temporomandibular joint, and at the same time how occlusion affects the craniovertebral joints. This is a 50-50% concept. One is basically related to the craniovertebral joints. In the area of the craniovertebral joints that we will relate in the three planes of space, does 50% of the function of how the cranium relates to the craniomandibular system. Cranium, craniomandibular, 50%. Cranium, cervical spine, craniovertebral, 50%. This is a system that works in both ways. Whatever affects the craniofacial craniomandibular relationship affects the craniovertebral joints. And the craniovertebral joints, when they lose their normal alignment, affects the craniomandibular system with a progression to a dysfunction or a disorder at the levels of the temporomandibular joints, with a special interest in how occlusion affects the stability or affects the progression of the pathologies in this area. That at the end, it relates to how we progress into a degenerative joint disease condition. So I would like to invite you to understand this bidirectional system of 50% craniomandibular, 50% craniovertebral, and occlusion for a stable situation to stay away from disorders, dyspathologies, progression into degeneration, headaches, and facial pain. It's a very special program working together with dentists, physical therapists, specialists in occlusion, and specialists in temporomandibular joint disorders. So we would like to invite you to this special event.